In the ever-evolving landscape of cancer treatment, one medication has emerged as a true game-changer: Imbruvica. This groundbreaking drug has revolutionized the way we approach the battle against cancer, offering hope and a brighter future for patients and their loved ones. Understanding cancer treatment options. Cancer treatment has come a long way over the years, with advancements in surgery, radiation therapy, and chemotherapy. However, these traditional treatment modalities often come with significant side effects and limited efficacy in certain types of cancer. This is where targeted therapy has emerged as a promising approach. The role of targeted therapy in cancer treatment. Targeted therapy involves the use of drugs that specifically target cancer cells, while sparing normal, healthy cells. This approach is based on the understanding that cancer cells have unique molecular characteristics that differentiate them from normal cells. By targeting these specific molecular changes, targeted therapy aims to disrupt the growth and survival of cancer cells, leading to better treatment outcomes. How Imbruvica works. Imbruvica, developed by the pharmaceutical company AbbVie and Johnson Johnson, is a targeted therapy that has shown remarkable efficacy in the treatment of various types of cancer. The drug works by inhibiting a protein called Bruton's tyrosine kinase, BTK, which plays a critical role in the survival and proliferation of cancer cells. Imbruvica's unique mechanism of action allows it to directly target cancer cells, disrupting their signaling pathways and inhibiting their growth. Unlike traditional chemotherapy, which can affect both cancerous and healthy cells, Imbruvica selectively targets cancer cells, minimizing damage to normal tissues. This targeted approach not only improves treatment efficacy but also reduces the risk of severe side effects often associated with traditional chemotherapy. Success stories and patient testimonials. The impact of Imbruvica on patients' lives cannot be overstated. Countless success stories and patient testimonials highlight the transformative effect of this medication. Patients who were once faced with limited treatment options and poor prognoses have experienced remarkable responses to Imbruvica, with tumors shrinking and disease progression halted. One such success story is that of Sarah, a 42-year-old woman diagnosed with chronic lymphocytic leukemia, KIA. Sarah had exhausted traditional treatment options and was told that her prognosis was poor. However, after starting Imbruvica, Sarah experienced a significant improvement in her symptoms. Her energy levels increased, and her lymph nodes began to shrink. Today, Sarah is living a fulfilling life, thanks to the power of Imbruvica. Imbruvica's impact on cancer survival rates. Clinical trials have consistently demonstrated the impressive efficacy of Imbruvica in improving overall survival rates for patients with various types of cancer. In a pivotal study involving patients with KIA, Imbruvica was shown to significantly prolong progression-free survival compared to traditional chemotherapy. This finding has been further supported by real-world data, which have shown a consistent improvement in survival rates with the use of Imbruvica. Furthermore, Imbruvica has also shown promising results in the treatment of mantle cell lymphoma, MCL, and Waldenstrom macroglobulinemia, WM, two rare types of cancer that have historically been challenging to treat. The introduction of Imbruvica has provided new hope for patients with these aggressive diseases, leading to improved outcomes and prolonged survival. Imbruvica's side effects and safety profile. As with any medication, Imbruvica is not without side effects. However, the side effects associated with this targeted therapy are generally well tolerated and manageable. Common side effects include fatigue, diarrhea, nausea, and bruising. These side effects are typically mild to moderate in severity and can be effectively managed with supportive care measures. One notable advantage of Imbruvica is its favorable safety profile compared to traditional chemotherapy. Unlike chemotherapy, which can cause hair loss, severe nausea, and immune suppression, Imbruvica's targeted approach minimizes damage to normal cells, resulting in fewer severe side effects. This not only improves patients' quality of life but also allows for continuous treatment without the need for treatment breaks. The future of cancer treatment with Imbruvica. Imbruvica represents a significant breakthrough in cancer treatment, but its impact goes beyond its current indications. Ongoing research is exploring the potential of Imbruvica in other types of cancer, including solid tumors such as lung and breast cancer. The success of Imbruvica has paved the way for further development of targeted therapies, opening up new possibilities for personalized and precise cancer treatment. Furthermore, Imbruvica's success has spurred the development of combination therapies, where it is used in conjunction with other targeted agents or immunotherapies. These combination approaches have shown promise in overcoming resistance mechanisms and improving treatment outcomes in certain types of cancer. The future of cancer treatment with Imbruvica is bright, with an ever-expanding arsenal of treatment options aimed at improving patient outcomes. Access to Imbruvica and insurance coverage. While Imbruvica offers immense hope for cancer patients, access to this medication can sometimes be a challenge. As a targeted therapy, Imbruvica can be costly, and insurance coverage may vary. However, pharmaceutical companies and patient assistance programs have implemented initiatives to help patients access this life-saving medication. It is essential for patients and their healthcare providers to explore all available resources and advocate for appropriate access to Imbruvica. Alternative medications for cancer treatment. Calquence, acalabrutinib. Calquence is another BTK inhibitor similar to Imbruvica and is approved for the treatment of KA and MCL. Zidelig, idelalisib. Zidelig is a phosphoinositide 3 kinase (PI3K) inhibitor used in the treatment of KA and follicular lymphoma. Venclexta, venetoclax. Venclexta is a B-cell lymphoma 2 (BCL2) inhibitor indicated for the treatment of KA and acute myeloid leukemia (AML). Arzerra, ofatumumab. Arzerra is a monoclonal antibody that targets CD20 on B cells and is used in the treatment of KA. Revlimid, lenalidomide. Revlimid is an immunomodulatory drug used in the treatment of mantle cell lymphoma and multiple myeloma. Velcade, bortezomib. Velcade is a proteasome inhibitor used in the treatment of mantle cell lymphoma and multiple myeloma. Considerations for choosing an alternative medication. When considering alternative medications to Imbruvica for cancer treatment, several factors should be taken into account. Cancer type. Different medications may have varying levels of efficacy for specific cancer types, and the oncologist will consider the most appropriate option based on the type and stage of cancer. Treatment history. The patient's response to previous cancer treatments and their treatment history will be considered when choosing an alternative medication. Potential side effects. Each medication has its own set of potential side effects, and the oncologist will discuss these with the patient to make an informed decision. Safety profile. Safety considerations, including risks of adverse events, will be carefully evaluated by the healthcare team. Treatment goals. The overall treatment goals, such as achieving remission, controlling disease progression, or improving quality of life, will influence the choice of an alternative therapy. Conclusion. Imbruvica's promise for a brighter future in cancer treatment. Imbruvica has emerged as a true game-changer in the field of cancer treatment. With its unique mechanism of action, impressive response rates, and improved overall survival, Imbruvica offers hope and a brighter future for patients and their loved ones. As we continue to delve deeper into the world of precision medicine, Imbruvica stands at the forefront, leading the charge towards a future where cancer is no longer a devastating diagnosis but a treatable condition. With ongoing research and development, the promise of Imbruvica in revolutionizing cancer treatment is only set to grow, providing new hope and possibilities for patients around the world. Imbruvica, ibrutinib, is a highly effective targeted therapy medication used in the treatment of specific types of cancer, but it may not be suitable for all patients. Fortunately, there are alternative medications available, such as Calquence, Zidelig, Venclexta, Arzerra, Revlimid, and Velcade, which offer viable options for managing cancer and improving patient outcomes. The choice of an alternative medication should be based on various factors, including cancer type, treatment history, potential side effects, safety profile, and treatment goals. With ongoing research and advancements in cancer treatment, patients have access to a range of effective therapies that can improve survival rates and quality of life. As always, it is crucial for patients to collaborate closely with their oncologists and healthcare team to make informed decisions about their cancer treatment journey. Thanks for watching.